evening and welcome to Thai PBS World tonight. The World Health Organization, WHO, has been working with governments around the world to fight against COVID-19. And so far, how has WHO in Thailand worked with Thai public health? In the Thai PBS World tonight, Kertesz and me talk to WHO representative to Thailand.
How do you see in Thailand's handled the way they have been handling the pandemic?
Yeah, I think it's true. For weeks now, we've seen a leveling off of cases in Thailand, even a decrease in recent weeks. And I think this has been in large part due to the physical distancing measures that we've lived, the lockdowns, the shutdowns, the slowdowns. These have really served to create physical distance between people. And I think this has been very effective in slowing transmission. I think if we have a concern, it's really everybody's concern. And that's as we ease these measures, we'll need to keep in mind one of the lessons we've learned from this virus, and that is its very explosive potential. We've seen countries that were thought to have had the virus under control, such as Singapore and Japan, now experiencing very dramatic outbreaks of the virus. So we should never underestimate the danger that this virus poses. I think that's why the government's approach of a gradual, phased lifting of restrictions is a good one. I think it's the right moment. We recognize that there has been significant hardship related to these measures. We've seen it all over the world. And it's normal that people should want to get back to earning their livings, but we have to be very, very careful. We have to be very cautious. It has to be done in a phased, strategic way.
And Dr. Kertesz, right now, Thailand is planning to have second phase of easing restriction probably on 7th of May. Do you think the timing is about right?
Yeah, I think the idea of phasing the lifting of the restrictions is a good one, and the idea of doing it every 2 weeks is not it's not an arbitrary decision. 2 weeks really represents the incubation period of the virus. So if we ease one set of restrictions, and we're strategic about easing one set of restrictions, we wait 2 weeks to see if there's an impact, to see if easing those restrictions has created a situation where we're seeing increased transmission of the virus. We wait for the 2 weeks. If we don't see it in the 2 weeks, go ahead and move to the second phase. And I think this, again, is a phased and strategic approach, and I think it's the right one.
So when you look at the figures, do you have any question about these figures? Do you think the figures that you have been hearing are reliable?
I think the figures are reliable. I think these are. I think what we're seeing is a good reflection of what is going on in the community. You know, we talk a lot about testing. Maybe I can just say a little bit about testing. When we talk about testing, it's not about testing for testing's sake to achieve a number or a target. It's about adopting testing strategies that will best find cases of COVID so that action can be taken. And testing is most effective when the health system has the capacity to then rapidly isolate and treat those cases that are positive and trace and monitor their contacts. And we're fortunate that Thailand has this capacity. Isolating cases and their contacts prevents onward transmission of the virus. I think this is one of the things that Thai authorities have been doing very, very well, and I think is one of the reasons why we believe that case numbers have been contained.
And at this point, what should Thailand be careful of trying to prevent second wave of coronavirus pandemic in Thailand?
It's very difficult to predict when there will be a second wave in Thailand or anywhere for that matter. I think what we can be sure of, though, is that a second wave or a new outbreak of COVID-19 in Thailand, whether it comes or how severe it comes, is in large part in our hands, and it will continue to depend on the continuing great work of the public health teams in identifying and isolating cases, that work that I talked about, tracing contacts. But most importantly, it will depend on the efforts of all of us in this country to follow the basic measures that we know work. And these are the measures that we talk about all the time: the hand washing, the respiratory etiquette, the proper sneezing and coughing, avoiding touching your face, your eyes, your nose, your mouth, and most importantly, attempting in our lives to keep a physical distance of between 1 and 2 meters between us and those around us. These 4 basic measures are so effective, and they're so important in protecting ourselves and those around us, from COVID and preventing transmission of the disease in our communities. We can remember to do these things, we can reduce the chances of a second wave.
Mr. Kertesz, the European countries have been successful with this pledging conference a few days ago. They were able to raise billions of euros to help finance research into vaccine and to help poorer countries deal with the situation. So I'm sure that the World Health Organization certainly would want to see other countries in this region follow in the footsteps. So have any advice for countries in ASEAN, for example, maybe to follow what the European countries has done?
I think what you're referring to is this recent consortium that's been built called it's an initiative, a consortium of partners, global partners, agencies, and it's called the Access to COVID-19 Tools Accelerator, and it's really a commitment on the part of a large number of partners and of agencies to do two things. And one is to accelerate the development of vaccines and therapeutics, but it's also to ensure that there will be ultimately equitable access to any of these therapeutics and vaccines that are developed. This is really key. And I think this is one of the things that it's really, and I think these two things, they're being done at a global level. They can also be done at a regional level. It's really critical that countries share information, science, technologies, progress on development of vaccines and therapeutics at the sub-regional level. And I think it's also critical that that groups of countries, regional blocs, continue to advocate at a global level for equitable access to any therapeutics and vaccines that are developed. It's really critical that when these vaccines and therapeutics are developed, they're going to be available on the basis of need and not on the basis of any other criteria.
Dr. Kertesz, one of the crucial factors in Thailand that WHO identify as the very good case that brings success to Thailand is local health volunteers at the village level. Can you expand on that, and what should Thailand do more on this?
Yeah, this is one of the things that was really, when I first came to Thailand, was really, really remarkable. I think village health volunteers are one of the elements of Thailand's primary healthcare system that make it extremely strong. There are over 1 million village volunteers who are in direct contact every day with the Thai population. And this is a tremendous resource at any time, but it is especially important in the context of COVID-19 and of this pandemic. I think volunteers can do many things, and I think what they're doing very well is educating the population about COVID, about what they should be looking out for, the signs and symptoms, and also help to monitor individuals who've been put into quarantine or help to trace contacts. Again, this is very tedious, hard work. And I think the real advantage is that village health volunteers, they know that they're closest to the people. They know what's going on in villages. And they're very acutely aware of any unusual public health events. So if there's a cluster of COVID-like illness in a community, they would be quickly aware of it, and they would notify that to public health authorities so that they may react quickly. So I think the role of village health volunteers is really important. And I know this system is very highly developed in Thailand. And I think it will be really important as we progress and as we move through this pandemic and we learn lessons. It will be really important to document this. And I think it's a potential best practice for Thailand to show the world.